hall from the time I'm attending AIOS. So I'll be speaking to you in the coming minutes on viral retinitis, a real emergency, and as Dr. Vishali highlighted, sometimes it is indeed an emergency situation. So I would just in detail describe this case, which will make you realize what it is like an emergency and why it is so. So we have the 68-year-old male patient who presents with sudden diminution of vision in the right eye for last 10 days, or he actually started having the drop of vision 10 days back, now starts having blurring of vision in the left eye for last 5 days. Past history, he has a history of paralysis on the left side of the face 6 years back, hypertensive for last 6 years, history of CAD, bypass surgery done in 2011, and also he was on EcoSprint, which he randomly stopped 6 months back. He was evaluated by another ophthalmologist in another clinic where he was diagnosed to have a BRAO in the right eye and referred to his treating cardiologist, assuming that he has stopped his EcoSprint and that's why he's having a fresh episode of a BRAO. He was restarted on a blood thinner. On ocular examination, the right eye had a low vision as finger counting at 3 meters, while the left eye was 636 N36. A slit lamp examination, however, showed an anterior uveitis response in the form of KPs and AC cells, which were confined to the left eye, which was the contralateral eye to the eye which had the BRAO. So when we did the fundus examination, we found the swelling of the optic nerve head, and we also found the retinal edema, which was corresponding to the BRAO that he was already diagnosed with at the other place. But what was missed out was the examination of the contralateral eye in detail. And if you see, this eye also had the optic nerve head swelling. There were these typical lesions which were in the periphery, suggestive of an acute retinitis. And also these lesions had quite a lot progressed and were encroaching now on the posterior pole. So peripheral examination of the left eye was done in detail, and what you found was these classical tongue-shaped lesions which were encroaching and progressing towards the posterior pole now. We did an OCT examination, but nothing was very significant except for this hyperreflective band, which is corresponding to the BRAO in the right eye. We did a fundus fluorescein angiography, again nothing very significant. And when we did the fundus fluorescein angiography of the left eye, you had this patchy mottled hyperfluorescence, which was corresponding with the area of active retinitis in the peripheral fundus. So a whole lot of investigations were done, and as you see, the viral profile, all the parameters were raised. So we started this patient on valcyclovir oral, 1 gram TDS. The EcoSprint was continued, and in the left eye, because the disease was very fulminant, we gave intravitreal injections of ganciclovir along with dexamethasone, and 6 injections were given in total. Oral steroids also were started after 3 days, and of course a risk of retinal detachment was explained to the patient. So follow-up at 1 week, the vision was finger counting at 2 meters. This was secondary to the BRAO episode in the right eye, while in the left eye also, the vision had not really improved and continued being as low as finger counting at 1 meter. And this could be very well explained with the extensive sclerosis of vessels, the pallor of the disc, and the extensive fibrosis, which was secondary to the healing patches of retinitis extending right till the posterior pole. So this is how it was. We just showed a resolution of that there's a disc, the pale disc is there, sclerosed vessels are there, and you see this is the laser barrage that we have done. You have extensive fibrosis. So where did the early treating ophthalmologist, where did he go wrong? You have an elderly gentleman with a history of CAD, diagnosed with BRAO in one eye, and he was straight away referred to the cardiologist without a proper examination of the contralateral eye. Viral retinitis in the retinal periphery of the contralateral eye apparently was missed out, and so antiviral therapy starting was delayed. Probably when you retrospectively look, the prognosis in the left eye may have been better if it was managed on time. So why an emergency? The topic was viral retinitis, a real emergency, because here ARN was a rapidly progressive outer necrotizing retinitis sparing the posterior pole with prominent inflammatory reaction, which apparently was missed out. and if treated on time, could probably have a better visual prognosis. So it starts with one or more foci. The good part is that it starts in the retinal periphery, but it has to be picked up on time and the treatment has to be started. The bad part is that it also is leading to occlusive vasculopathy, which very much grossly compromises on the visual prognosis. The etiology can be any of these viruses which you can be dealing with. When you review the literature, you can find that the occlusive vasculopathy can occur secondary to any of the viral infections in the eye. And that is why it's an emergency which has to be treated on time. Otherwise, it can lead to a drastic fall of vision, which is non-recoverable. So you can have various viruses, the herpes group of viruses. You can have the CMV virus, which is more commonly found in the immunocompromised patients. That's why you need to check out the immune status of your patients. Sometimes when you are in doubt, you can also collect a vitreous sample and send it for a PCR sampling, which is extremely useful for diagnosing the viral etiology. However, timely intervention does play an important role in salvaging the vision in such patients. Inflammatory etiology as a cause of occlusive vasculopathy should always be kept in mind in any age group that you may be dealing with, even in an elderly patient, and a thorough retinal periphery examination is essential in all the cases. Early diagnosis and a timely management with antiviral therapy and anti-inflammatory drugs do play an important prognostic role. Thank you so much.
Thank you, Manisha. I think the carry home message in one line is, if you're suspicious